One of the hottest topics in obstetrics in this day and age is who is a good candidate for a VBAC or TOLAC, trial of labor after cesarean section. So the important points to remember are: one, there is always a risk with anything of what we do, whether you do a repeat C-section versus a trial of labor. Two, the risk of a ruptured uterus is 1%. This could happen in the best hands, in the best place, in the best hospital. So just remember that this is an unpredictable risk, very rare, but when it happens, it could lead to a catastrophic event, including potentially the death of the baby. Now, who is a good candidate to try? Important is to remember what was the reason for the previous cesarean section. If the cesarean section was done for failure to progress, for example, you were in labor and for many hours you were 8 centimeters and you couldn't deliver that baby, maybe you're not a good candidate to try a VBAC because chances are that this situation is going to happen again. If you had a normal vaginal delivery, the second baby was a breech presentation or fetal distress, and you come back pregnant the third time, you're probably an ideal candidate for a VBAC because we already tested your pelvis. So we have to go case by case, but the important thing to remember is that that risk of the ruptured uterus is unpredictable and it could happen to anybody.